really struggled with my feelings about posting this, but I can't shake this feeling that I have. So please bear with me and take it where it's coming from. The rise of the weight loss medications has me a little concerned, not because I don't think they're really valuable and life-saving medications when used appropriately, but because there's a huge rise in off-label usage. That means in people who have a BMI under 27 or who do not have diabetes. So in other words, I think you need to understand this is a data-free zone. There's no information that we really have, particularly with respect to long-term use. Having said that, I had an experience the other day that I really want to talk about. I had a patient who declined an important procedure because they told her she'd have to come off her microdosed GLP-1 for a month. And she refused to do that. So she actually declined the procedure, and alarm bells went off in my head. Now, the reason they ask you to stop is because it's slowing down your gastric emptying, and this can lead to aspiration when you're under anesthetic. But then my mind started racing. Like, what about emergency surgeries? What about life-saving procedures? Never mind elective procedures. And so I just really think it's food for thought. This patient wasn't aware when she started the medication that it would have that sort of implication for her in the future. And it's just another thing to be mindful of. If you are considering using these medications, just know that there will be times you'll be asked to hold them for a period of time. And you really need to start thinking about the risks versus benefits for yourself as an individual and what could potentially come down the road for you health-wise that might overwhelm the importance of that medication for you. I hope this is helpful. And again, I do refer patients all the time who meet criteria, but this is, I think, a data-free zone, and we have to be mindful.